Jeffrey, what do you think about in terms of preventing hospitalization? How big a factor is relapse in our desire to prevent hospitalization?
Well, the biggest factor to prevent hospitalization is insurance, or not having insurance, because you don't get admitted. But
you recommending that?
well, I think it would be nice if our country developed a healthcare policy and financing system that addressed the needs of the entire population. But I think, the issue of adherence is a problem, as you mentioned, in all disease areas and specialties of medicine, but it's more so in psychiatry and with mental disorders, and more so maybe in schizophrenia because of the effect on cognitive function and insight. But if you think adherence can be, I forgot to take my medicine, or I didn't get my disability check, so I couldn't get to the pharmacy to pick up my prescription. Those are just logistical things. But doctors also have to be very sensitive to the other factors that foment non-adherence, side effects. When you prescribe a dose of medicine, it's therapeutically effective. How closely do you evaluate the side effects that patients may be experiencing and could impel them to not want to take it, and then try and do something to mitigate those, whether it's lower the dosage, add some effect, a medication that counteracts the effect, or consider switching them to another antipsychotic medicine, or adjust the dose. That has to be addressed. And to the extent that it's an insight issue or a lack of understanding what the consequences are, the process of further educating and engaging in a dialogue, I think those are things that can have an impact on the adherence rate. But, to have a relapse and be rehospitalized is really a catastrophic complication of an illness, particularly now, because hospitalizations don't do what they used to do. They don't really just stabilize you and get you really redirected, ready to redirect your life. These are now like crisis management situations, and so you can come into a hospital, you can be there for a few days, they can patch you up and they can send you out, and then you're on your own again. And if your aftercare doesn't remain in place and you're going to a new aftercare arrangement, who knows how good that's going to be. So just like relapse is to be avoided by all costs, I think the associated possibility of hospitalization is under the current circumstances.
One thing I just want to say, you were, I strongly agree that we need to be carefully monitoring for side effects of antipsychotic medications and manage them. There are a number of effective management strategies. But, my understanding is that that's actually not the main reason people end up stopping their medications. In our studies, it's the people stop because they don't perceive a benefit.
Mm-hmm. So in bipolar disorder, a big complaint that leads people is because they don't have the same, they feel like their emotional vibrance is dulled, or they have some, and that potentially is a side effect that impels them to want to not take their antidepressant. So in schizophrenia, do you think that actually isn't a direct connection, that people who, if they're gaining weight or if they're experiencing restlessness, that's not a factor?
I think it is a factor.
It's not the primary factor. I think that's the distinction.